Hello everyone, I am Dr. Sandhya Rani, Senior Consultant Obstetrics and Gynaecology Department in Aster Women Children Hospital, Bangalore. So today we are going to discuss about fetal kick count. So pregnancy is an exciting journey and feeling a life kick within you or move within you is even more exciting. But then the trouble begins if you're not very confident about the baby's movements or the baby doesn't move enough for a day. So, how much enough is enough? That is what we are going to discuss in the next few minutes. So, when does the fetus start moving inside the mother's womb? As early as first trimester. But the woman perceives the fetal kicks or movements only in the second trimester. So for a first time mom to be, about 18 to 20 weeks, and for someone who has gone through a pregnancy earlier, about 16 to 18 weeks. So what would be the initial movements like? So most women describe it as flutter, vibration, or jerk in the lower tummy. Some of them describe it as bubbles in the lower tummy or something similar to gas in the tummy. But as weeks progress and as the baby's size increases, the woman will be able to feel the movements better. So after 28 weeks, that is in the third trimester, is when we discuss with the woman about monitoring the fetal kick count, or as it is recently retermed as fetal movement pattern. So why after 28 weeks? Because by then the baby is big enough and the woman perceives about 90 to 95% of the baby's movements. In high risk cases, we start this about 26 weeks itself. So what kind of movement should the woman watch out for? Any kind of activity inside the womb. It could be a big somersault kind of movement, or a side to side rolling movement, or a flutter, or a swish, or a small kick. Any activity is taken as a movement. So different ways are there to monitor the fetal movement pattern. We have the fetal kick charts where a woman starts noting the number of movements from 8 a.m. to 8 p.m. Minimum of 10 episodes of movements in 12 hours is said to be okay. That assures us that the baby is comfortable inside. The other way is how long does the baby take to finish those 10 movements? On an average, 2 to 3 hours. So what does a woman do if she has not felt the movement for 2 hours? Okay, so baby sleeps for some time in the mother's womb. Minimum 20 minutes, maximum it may go up to 90 minutes. So 1.5 to 2 hours of no activity inside the womb is perfectly normal. 2 hours passed, if the movement is not felt, the woman is advised to do something to wake the baby up or stimulate the baby. It could be eating something or having a soft, sweet beverage, hot or cold liquid. She may turn to the left side and lie down where the baby gets better blood flow and starts moving. She can speak to the baby, she can sing. The woman may play some music, sound stimulates the movements of the baby. She can gently massage the tummy or pat the tummy. These are all different ways to stimulate the baby or wake the baby up. So you can start trying one of these every 10-15 minutes. So 3.5, 4 hours have passed. You have exhausted all these options and still not felt a single movement. You are supposed to report to the hospital, right? So what are the reasons why don't babies move? So it could just be a false alarm that the baby is sleeping a little extra while, and by the time you reach the hospital, most often the baby moves. But it is still okay to report to the hospital so that we don't miss out on any complication. The other medical reasons could be less amount of amniotic fluid, too much of amniotic fluid, baby not getting enough blood flow or not getting enough oxygen inside, a very tight loop of cord around the baby's neck. So when you report to the hospital, these are the medical conditions that we look for. So what can you expect when you come to the hospital? So first the doctor would examine your history and try to identify if there are any risk factors. After that, you will be subjected through a test called CTG or cardiotocography, where you will be asked to lie down on the back for 20 minutes. There's a machine connected to the tummy, and like an ECG graph, the baby's heartbeat graph is taken. Depending on the pattern of the heartbeat in the graph, we can assess the health of your baby. If the CTG is quite comfortable, or what is called as a reactive CTG, you will be sent back home with the reassurance that everything is fine. In case there is something suspicious, or by the end of CTG also you have not felt the movements, you will be subjected through an ultrasound. ultrasound to assess the water levels, the weight of the baby to see if it is growing well, and to assess the blood flows to the baby. If all these three are fine, you will again be reassured and sent back home. But in case there is a deviation, then the doctor will discuss the further steps of action. So it is good to feel the fetal movements. It is even better to keep a good track of them and report to the hospital in case you are not happy with the baby's movement. Hope this information helps. In Aster Women and Children Hospital, we do have 24/7 facility for CTG testing and ultrasound. So in case you want to know more about this, you can always reach out to us. Thank you.